it's Nikki, Doctor of Physical Therapy here at Greencastle Physical Therapy, and we're going to go over an exercise we call an oblique isometric. So, as the name implies, we're going to try and work our oblique muscles, and those are the muscles on the outside of our waist, not deep into our spine. They're kind of really along the rib cage. They attach and really help give that compression all the way around to keep our spine nice and tall and allow our core to work throughout the day in a very safe way. An isometric is just a hold. So to do this one, we are going to use some bands. So at home, you can use a doorway. We want the band around waist height. You can shut the band in the door if that works for you. But again, we're trying to be at waist height as we go here. When we start, we can keep it close to our belly. We're going to step out until there's some tension on the band. And then when we're in position, you can grab on with both hands. I like to grab on with both hands because it allows us to keep in the middle and not let one shoulder overpower and overdominate the other. So to start, we'll sit back a little bit into the hips. That allows us to get a good foundation already from the glutes, knees pulled out just a little bit. Hands held together here, and then we're gonna try and straighten those arms out. What we don't wanna do is just try and let the shoulders do all the work. If those shoulder blades are a little sloppy, we're gonna ask our shoulders to do everything. You're doing it saying, well, I feel a pretty good shoulder workout, but I'm not necessarily feeling it in my waist. So as we straighten out, we're trying to pull those shoulder blades down and back, really sinking them towards the waist so that they're anchored in place. And now the thing that's preventing us from twisting is the waist and those oblique muscles. So sitting back, we'll keep those elbows kind of squeezing in a little bit, slide those shoulder blades down and back as we straighten forward. And we want our hips to just be holding us in place. And now our waist is preventing us from being pulled back. We'll hold that for about 10 seconds. So hold, we want to breathe as we do that. If we have to hold our breath to do this, it makes it a very unfunctional exercise. Breathe, that's all we do every day. So make sure we try and keep a very fluid breathing pattern, no breath holding. So straighten out, pull those shoulders down, 10 seconds, then just bring it back into your chest. And then once you're ready, we'll go into the next one. Sitting back, pulling those shoulders down, really trying to get the outer waist working, and bring it on back. We can hold, like I said, 10 seconds and do about 10 reps on each side.